I'm Dr. Suneetha Narreddy, Infectious Disease Consultant at Apollo Hospitals, Hyderabad. Today we are talking about the BA.2 variant of Omicron. We have seen COVID for the last 2 years. Started off with the wild type and then we talked about Delta and Omicron. What we are hearing now is Omicron is taking over North America, China, Europe and so on. So the fear is what is going to happen in India. But if you actually look at it, in India we have had Omicron in January, while most countries in the world had BA.1 at that point. For us, we have had a significant proportion being BA.2 as well. So as far as India is concerned, what does it mean? First of all, Omicron itself is a mild disease compared to the Delta variant. Now, how do we develop immunity? Immunity develops when you have vaccines and if you have infection. The combination of a previous COVID infection along with the vaccine gives the best immunity possible. And when we look at the community that we are in, where we have had significant amount of COVID already, particularly with the BA.1 variant or the BA.2 variant, along with vaccination, then that gives a pretty robust immunity. So what do we worry about when we talk about BA.2 variant? Most likely, virus itself is not going to cause a major problem for us because we've already been exposed to BA.2, and especially because we have been vaccinated. And so that comes to the next point as to who should be vaccinated. Is there a need for the entire population to get a booster dose, because that's what we're talking about these days, or should we prioritize? What is clear is that every person should be taking the first 2 doses of the COVID vaccine. The 2 doses of COVID vaccine along with the natural infection gives robust immunity. Who do we need to prioritize for the booster vaccine? We need to prioritize booster vaccine for those that are at high risk. People who are elderly, particularly more than 50 years with comorbidity or more than 60 years, irrespective of comorbidities. Anybody with comorbidities in general, particularly heart disease, lung disease, kidney disease, liver disease and so on. Why do we need to prioritize these people? Because they can develop a severe disease. We do know that Omicron causes a mild disease and there's a disproportionate amount of infections with Omicron as compared to the need for hospitalizations. In this scenario, the need for vaccination is to be prioritized to people who are at high risk. Our younger population has not had enough vaccination. So it is important for them to be vaccinated with the primary series, that's the first 2 doses of vaccine, and prioritize the booster for those in need for the additional protection. Thank you.